share my screen and get started. Okay. Let me know if you can see my screen.
Yes, I can see the screen.
All right. Hi everyone. I'm Toby from Intron Health, and we've created the first speech-powered electronic medical record that supports accents in Africa. And I think the problem that brought us here was that we realized that many hospitals were trying to transition to electronic medical records, but not everyone has the same level of computer literacy, particularly on the keyboard. Not everyone is able to um, type at the same speed. And we realized this was a huge problem at some hospitals because if you're a doctor in any developing country, you probably see anything from 15 to 30, 40 patients per day if you're at a very busy hospital. And so, particularly at these types of sites, it may be harder to transition to digital systems because you would have doctors, nurses who may not be able to type quickly, and this can start to worsen patient wait times. And we had a hospital where after installing their EMR, actually their health outcomes got worse. Revenue dropped because people were taking several minutes, 20, 30, 40, 50 minutes to complete their notes. So patient wait times were worse. Clinician burnout increased, and decided to lose patients and lose revenue. So basically, if there's this obstacle to data entry, then there's no data in the EMR, and of course we don't have the data we need to drive insights to help run clinical decision support. So basically, we figured out that speech might be an easier way to remove this obstacle for data entry across several hospitals. And of course, we would have picked up some available speech recognition system out there. There's several of them by Google, Amazon, Microsoft, but many of these systems work very poorly with African accents. So we went ahead to attempt to create our own system, and it's the first speech recognition platform that's clinical focus for African accents. And we currently support over 200 African accents today, and we can integrate our software into the EMR directly. And from an initial study we've done across 4 African countries, we've observed that this software is able to give up to 7 times speed up. The average speed up is actually about 5.5 when you compare the speed increase on the keyboard versus speech, because everyone is more comfortable talking than typing, and we're able to help significantly increase efficiencies for clinicians. This was possible because we were able to create the largest clinical speech data set on the continent, about 1.1 million clips, to 240 accents across Africa, 7,000 speakers. We're currently above 90% in accuracy, and we're able to help hospitals increase documentation quality. There were a number of hospitals who reached out to us to say, since they switched to their EMRs, the quality of documentation dropped because people are so in a hurry, they can't type, and they do a lot of copy pasting. They use a lot of shorthand. People write very few lines because it's just too stressful. But with speech, they can get better quality documentation, and even the experience of the clinicians at the hospitals has improved. The most important value we think we can drive is to help accelerate EMR AMR adoption by clinicians. And once data starts to flow into the database on a daily basis, then we can start to do a lot of cool research on the back end. I think so recently we launched a competition on the Zindi platform to give access to our data to the public so that people can also learn a bit more about the unique challenges with speech data in Africa. We're using this project to drive our contribution to open source and hopefully also drive interest in what we're doing. Lastly, I'll just share some recent progress I'll be happy to start projects across Africa, particularly Nigeria, Ghana, South Africa, and Kenya, where we have deployment in a number of hospitals or projects we're discussing there. And we recently partnered with NVIDIA to increase access to speech recognition on the continent, and we're doing a project with the Commonwealth to improve access to this technology for small states, basically. Thank you. I think that's the end. Do I have questions? Or do we move to the next speaker?
Thank you for your presentation. We're gonna keep all the questions to the end. I'm gonna go ahead and introduce the second presenter. Dr. Tom Kinyaji. I'm sorry if I didn't pronounce your last name correct, but you can go ahead and share your screen and start presenting. Thank you.
I can see my screen, okay?
It says loading. Yes, I can see it.
The pronunciation is Kinyanjui. That was a nice try. I'll start at Neurolabs Africa. We impact healthcare using technology. Almost half a decade ago, I lost a close friend to an entirely preventable disease. But this is a story of hundreds of thousands of other Africans. In fact, about 15% of all deaths in Africa would be avoidable with timely diagnosis. But diseases will run rampant due to overburdened and under-resourced health systems. Patients will have to wait for up to 2 weeks to receive analyzed lab results, especially in marginalized communities. But when aggressive diseases like pneumonia, especially in children, can kill in less than 3 days, longer wait times are definitely a death sentence. We have developed a technology that screens medical images for radiologists and hospitals in real time to identify common indicators of pneumonia, tuberculosis, lung cancer, as well as breast and prostate. Now, instead of waiting for hours to receive analyzed lab results, we empower doctors and hospitals to provide accurate diagnosis before even patients get their shots back on. Most of the users of our services will be radiologists, hospitals, and diagnostic labs who pay both on a transactional and subscriptional basis. In Kenya alone, there are as many as 630,000 X-rays done every month. Currently, we are operating in Kenya and Senegal, where we are working with UNICEF Innovation Fund to run clinical trials of our solution to assess key performance indicators like specificity, sensitivity of our technology. We have a team with a combined 70 years of experience in healthcare, business, and technology, as well as with experience working with big data in platforms such as Kaggle and Zindi. Africa. As a team, our mission is to democratize access to diagnostic healthcare for all in Africa. That's what we mean as DG3. So we welcome you guys to be part of our missions to democratize access to healthcare for all in Africa. Thank you.
Thank you for that presentation. So we have our last presenter. I think he's already sharing his screen. Dr. Zakir.
Yes, hi. Can you see my screen?
Yes, I can see your screen. So you can get and start when you're ready.
Good morning from Los Angeles. Hello, everyone. I'm Dr. Zakir Sikder, co-founder and CEO of Histophy. I'm delighted to have this opportunity today, and thanks to DSI Africa, to introduce Histophy, a medtech platform company dedicated to offering cancer diagnostic and treatment decision support resources to healthcare providers in developing countries. Our mission at Histophy is to decentralize advanced cancer care technology to promote equitable access. Many of you in the developing countries may relate to the background of Histophy. In 1995, I embraced telemedicine technology at its infancy to manage my mother's low back pain in consultation with physicians in USA. In 2001, I developed an early telepathology system in Bangladesh to obtain a diagnostic second opinion on my father's lung cancer from the University of Nebraska Medical Center. Those two events, along with my experiences as a caregiver, physician, and a family member, have deeply impacted my clinical journey. And I have been planning on creating a cancer care platform like Histophy since 2001. Fast forward to 2019, I founded Histophy in Los Angeles, California, when I was confident that the time, technology, and the opportunity had aligned. During the first half of my clinical practice in oncology in Bangladesh, I used to import technologies from developed countries to benefit my patients and peers. Since 2012, as I am stationed in California, I'm exporting cancer care technologies from here to my peers in developing countries. I'm doing the same job from opposite geography due to my proximity to the biotechnology innovation hub of Southern California. Being a clinician from a developing country, I often see providers in developing countries distancing themselves from modern technology due to significant costs and complexity, which often limits their ability to deliver effective cancer care. Consequently, patients seek treatment elsewhere or travel abroad, leading to the lost time for patients and lost revenue for providers. These factors, coupled with 95% out-of-pocket care costs for patients, perpetuate a cycle of poor health outcome. We provide our solution through the Histophy platform, where clients utilize various applications to offer two categories of services: an affordable selective option and a more comprehensive option for complex cases or patients with high financial capacity. Our approach makes data-driven personalized cancer care accessible to a wider patient demographic. Our platform operates through three modules: a care path navigation with patient data visualization, AI-augmented diagnostics, and treatment planning, including electronic referrals. The platform features 9 specialized clinical and patient data capture applications that create a connected cancer care ecosystem. We have already seen remarkable results. Patients have seen a 40% reduction in costs and 70% faster diagnosis to treatment planning times. Our partners or clients have experienced a 25% increase in profits and enhanced level of patient trust. Each country, its population, its healthcare, and socioeconomic needs are unique and require unique solutions. We initiate a scoping dialogue with our partners to develop a custom solution, either by outsourcing to Histophy's cooperative lab network or by internalizing the diagnostic capacity to meet their market demand. At Histophy, we regard a single patient as our world, a customer, small or large, as our point of care, and each country as our channel to save patients and their families from the misery of cancer-related early deaths, disability, and financial ruin. We begin by empowering healthcare providers with technology tools that might otherwise remain out of their reach. I'm concluding by summarizing the challenges faced by oncologists in low and middle income countries. In the United States, cancer deaths have reduced by 33% over last 3 decades, with 73 oncologists available for every 10,000 new cancer patients annually. In contrast, low and middle income countries like Kenya and Bangladesh, where I come from, have only 1 and 12 oncologists respectively. Developing countries accounted for 70% of global cancer deaths in 2021. To overcome these challenges and to change the status quo in low and middle income countries' cancer care mechanism, we have undertaken the task of building a technology bridge between the two worlds to assist cancer care ecosystem stakeholders worldwide in curing cancer. We sincerely welcome you to join us and strengthen our efforts to bridge the gaps in cancer care. Please feel free to contact us for more information. Thank you very much.
I just want to give a thank you for all the presenters today. We can start with any questions any participants have. You can use the raise your hand option at the bottom of the screen, or feel free to write on the chat.
Hey, Aisha, I think there are some questions in the chat. Would you mind maybe reading them out for the panelists?
Yes. Laura, I see your hands raised. You can go ahead and ask your question.
Yeah, thank you. Thank you all for the great presentations. I was just interested specifically with the Intron Health presentation, if the speaker could comment on any kind of feedback they've received from providers on kind of how they view their technology and kind of if they've incorporated that feedback into the technology moving forward. Thank you.
Yeah, hi Laura, thanks for the question. So yeah, we get feedback every day. We get users who say all sorts of funny things on the software and try to get it to make mistakes and all that. So yeah, just from a testing standpoint and at the hospital itself, we get a ton of feedback every day. I think I think one of the most useful things we've had to do for some hospitals is to provide, for example, headsets that help like reduce noise and all that. But most hospitals have been surprised about how accurate this software is, because most people don't trust speech recognition because they've used it a lot in the past, and it just never works. But at least for the first time, this was built specifically to support African accents. And I think the goal from a hospital standpoint is they've invested in an EMR, but they're not getting as much adoption from their clinicians because, of course, the clinicians are already busy, and so we're helping bridge that gap. But yeah, I will get feedback all the time, and I mean, we'll please, if anyone wants to try out the software, you can try it for free. I'll post a link. You can create an account and just see how it works on your accent, and if our coverage of accent works well for your country, your city, or something. That's definitely also feedback we want to get. Like where does it work well? Where does it not work well? We try to cover some of the major clinical specialties, particularly because of the terminology, the vocabulary in those specialties: surgery, general medicine, and pediatrics, and a few others. But of course, there's still a long way to go in terms of specialty coverage. So absolutely appreciate more feedback.
Thanks, that's really interesting.
Thank you. We have a question from the chat from Ibrahim for Intron Health. What kinds of pushbacks have you had from providers, if any?
Of course, as you can imagine, some people are just like, "Hey, I have too much work. Don't add a new don't add new technology to my work," until they actually try it out. One really interesting pushback we got from a lot of people initially was that, hey, some people feel like they can type quickly, like, oh, I'm already comfortable with typing. This is probably not something that will give me any significant benefits. However, the first time we created a test for people to do when they on board. They do a small document, a very short paragraph, actually, just 74 words, and we ask them to type it out and also dictate. And many people are surprised at how inefficient they were compared with just speaking. The average speed up, I said, is 5.5. Some people had up to 7 times speed up to 9 times speed up. The fastest person that has done that test had a 40% speed up, and that's just something that's really counterintuitive for people, because sometimes they feel like they're comfortable with the keyboard. This is particularly useful for older people who have a hard time, like, with the keyboard, who use 2 fingers to type. So for people like that, they get a lot more benefit from using the application. Some people have complained initially that, like, how do I use speech for dictation, for example, in clinic when the patient is still there? Do we wait for them to leave, or do we do it after work and all that? And the usual thing I say is that this speech recognition has existed in clinics all over the world for over 2 decades. It's used everywhere in the world. People usually would wait for the patient to leave, sometimes maybe do a few notes while the patient is there, and then dictate their notes, particularly for long clerkings, like when you have a new patient. That's where, like, you really need that time improvement. So that's one major pushback we got initially, but I think doctors are finding ways around things like that.
Okay, I see a hand raised from Sandhya.
Yeah, thank you. So I was, I guess, interested more from history, because I think that you're incorporating genomic data into your analysis. And so I have a few questions, and I'm Sandhya from the National Human Genome Research Institute, which is why I'm very interested in the use of genomic medicine. And I'm wondering, especially from the not so developed countries and the poorer nations, how many of them actually have genomic data, and what are some of the ways in which they are able to utilize genomic testing? And then the second question was more from your analysis perspective, your use of standards for a genomic data analysis, and also like repositories like ClinGen and so on. So I'm sorry, it's sort of big questions that I have, but any light would be great. Thank you.
No, it's very important, and thank you for these questions. And just to tell you that we are a startup and in the early ages of our companies. So we have been working with genomic data extensively. So at this moment, not many labs are available in the low and middle income countries. So that's why we have two options. Either they can outsource by shipping the biopsy sample to our CAP and CLIA certified labs in Los Angeles and Irvine area, or if the demand is high, like we are having a dialogue with some of our potential clients in Africa to set up genomic labs or next generation sequencing labs in those countries, depending on their market demands, and also in Far East Asia and South Asia. So, it works like this. Suppose a patient requires say pancreatic cancer patient, we received a sample from Morocco last week. Unfortunately, it was so complicated and late case, the patient expired, but they got to see the data from all the mutations and the variations into DNA and RNA level. So the physicians and the oncologists got clear picture what they could have done. So this is not only a clinical reporting and data capture, it is also allows the clinicians to learn for next patients. In addition, we have a tool, we call it virtual geneticist. Actually, it provides you access. Suppose you have an NGS lab and you can upload your data into your account from the sequencing test, and you can play with it and you can create your own reports. So this is already in trial, and it's going smooth, and we hope to share this virtual geneticist application to all the clinicians, and we are trying to make it free for clinicians who are on our platform. So have I answered everything, Sandhya, or you can reach out to me by email,
Sure.
for further discussion.
Yeah, so I was questioning more in terms of your use of ClinGen and some of these other genetic resources. So what resources do you use to check for what is a pathogenic variant? Or, I mean, do you provide any annotations for the variants that come up?
Yes, and first of all, we have a validation process. Whatever data comes from the lab, we validate first for accuracy and other regulatory issues. So once it is validated, then it goes into the reporting platform. So we are even detecting RNA fusions, and there are a few other items. So it's quite awesome how much data in a single patient. I call them a medical library. Each patient is a medical library. So we are trying to documenting properly, and then create a relationship with their past life and the future recurrences or future course or future treatment. So our aim is to use data science in order to maximize the outcome of cancer care. And if to tell you very frankly, we are coming up with new tests, early cancer detection, at least 1 to 2 years before, like liver cancer, pancreatic cancer. We can target the population and do the testing. More interestingly, if you want, we can set up the lab in Africa, in any country you want, and it's not a very high cost. So that's the uniqueness of HistoFi. I come from the developing world, I practice there, I know what they need, and I'm trying to give everything. My team is awesome, to tell you very frankly. They have 25 years of average global health industry expertise.
Thank you.
You're welcome.
Are there any more questions, comments? Feel free to put in the chat, or again, use raise hand option below on your screen.
Yeah, just something for the group. If people have observed any other like major obstacles to EMR adoption at like hospitals or health centers. Please feel free to share in the chat. I think speech is one of the major obstacles hospitals. The keyboard basically is one of the major obstacles hospitals face. So, but if you've experienced any and that you think it's possible to solve with data technology or AI, please feel free to share in the chat.
Okay, Zakir, you have the floor.
Yes, I wanted to ask a question to Toby. And Toby, are you offering EMR along with the transcription application, or you are integrating with existing EMR?
Yes, so great question. Both of them. So for a hospital some hospitals have had a very bad EMR experience, or they don't have support from the EMR to integrate, or or basically they've had a very bad install, they have no EMR. We also want to be able to provide like the full solution where it's needed. But yeah, most of our clients are hospitals that already have some form of some EMR already in place. But we also have an EMR of our own, which you can see on our websites, which I would provide a link to.
Okay, thank you.
Can I ask all the presenters to put their emails in the chat if you haven't already? Thank you. Any more questions from the audience? Lillian Prince, I see your hand. You have the floor.
Yes, sure. Thank you so much. It's very informative and wonderful to learn about these initiatives. So I have a question for Toby. So I was thinking and wondering, had he thought about rolling this out to patients? Because one thought is coming from what he had mentioned about when to start speaking, to wait for the patient to leave, or should he start doing it while the patient is still in the room? So had you thought about, maybe having something the day before, like making some type of implementation in the medical record or on the person's phone? Like, I'm just thinking out loud, if it's some way to capture the patient's symptoms, so then that way the patients can tell you themselves via voice activation. So then by the time they get to see the doctor, then, there actually kind of would be less that the doctor would have to chart when they are seeing the patient. So it's just thinking out loud, just thinking out loud as a result of what you presented.
Actually, that's a great idea. There's a hospital, so that's already like moving more into the EMR space where you have access to the patients, their appointments. So basically on the EMR side, hospitals are able to set up appointments for patients, or patients are able to basically book appointments. So in that scenario, then we can send what many hospitals call an intake form to the patients, where they can fill out their symptoms, and that could help save time at the hospital. So we're actually discussing that intake form with the hospital right now, but it's really going to be interesting to actually put to make voice available for the patient as well, to just speak about their problems, their symptoms. So really nice idea. Thank you very much.
Awesome. Thank you.
Great.
Any more questions from the audience? If not, is there anything else you'd like to add? The presenters, is there anything else you'd like to share? Danny, would you like to verbally ask your question?
Hello, can you hear me?
Yes, we can hear you.
Oh, thank you. Yeah, so I'm just from trying out this speech recognition service. So I just wanted to find out like how accurate is it in terms of transcribing this speech, because I just tried out like one of the speakers as he was talking. There was quite a number of typos in it, and
Yeah. So that's yeah, good suggestion. And please please feel free to try it out. The way so if you're asking your microphone to record from your speaker, from the speaker on your device is putting out sound and the microphone on the same device is recording sound, it doesn't really work out very well. There's you need special software to do that concurrently. So the way the app works, more often than not, is if you are speaking directly into your microphone, not if it's receiving feedback from. And this is pretty much the same with most speech recognition applications, or almost any audio application. It just doesn't work out right if you're asking the same device to speak and record at the same time. It just doesn't work out well on the board. So that's something we've also noticed. The other thing we've noticed is people who are not aware that their bandwidth is not great while they're speaking. Same thing like a WhatsApp call. There's a red thing that would come to you when you see, your call is reconnecting. If you weren't looking at that, you would not realize that your voice wasn't even getting to the app in the first place. So those are some quirks we've noticed. We're building something that can help people realize that, hey, network is poor or audio quality is poor, and so that will likely push out sometime this month. So just gives people feedback when you are speaking or you're providing audio that's not good quality, so that at least people get that feedback early and they can change their settings. But please, we appreciate feedback. If you use the application and it looks like it's not accurate, please let us know. That feedback helps us develop and continue to improve the software. But and for most people, we're able to achieve about 90% or thereabout accuracy.
okay, no, thank you so much.
Great, thank you.
Thank you. I see Peter, you're off mute. Would you like to ask a question? Okay, so I have a two-part question for the presenters. First part is, what are you looking for in a partner for your future work? And also, can you share advice to the group about partnering successfully?
Should I start?
Yeah.
Okay, in cancer-related data science, as we may talk about, it's a very high demanding and complex issue. So even I was gladly listening to Toby, and I think if we can create a collaborative network, there are some gaps or missing points in the data collection methodology method, and I believe the data is as good as the sourcing of data methods. So the area is wide open. So we should start communicating, sharing ideas, and in a networking platform like this. This is awesome. I learn more than I can ever give. And that's where, we welcome any feedback, any question, and any interest into Histophy. We are just making our first few steps. We have a sky-high ambition and a long way to go. So thank you for attending this event, and I look forward to networking and collaborating with more from Africa. We are already working in Morocco, Nigeria, and few other countries in discussion. So we try to make it as painless as possible. And in terms of data science, I see the most complex issue and the expensive issue is the data infrastructure. So a lot of big companies, corporations like Microsoft and AWS, they're putting up infrastructures, but it has to be made a lot more painless for small to medium healthcare facilities or practitioners to jump on board. So that would be my advice. It has to be made much lower cost, the infrastructure. Thank you.
Okay, where the breakout room is closing in 50 seconds. I just want to say thank you to all the presenters and the audience, and see everyone in the plenary. Thank you.
Hello, everyone. I hope you had a good discussion in your breakout rooms. Thank you all again for staying with us for the full program today. We're going to be moving into our final round.